Empower Simcoe is a community organization providing programs and services for all individuals within our community. Yes, we do have group homes. We have 41 group homes within Simcoe County in Barrie and Orillia. However, we have a number of other services that we offer, including early years and early on. So families can come into resource centers and have their little ones play within an environment that is based on curriculum and established pedagogy. So that is something that we do. We have the early on centers in all over Simcoe County, actually. We also have employment supports, which is helping individuals to bridge between school and the workplace. So we work with a number of community partners and over 400 companies within Simcoe County to deliver those services. We also have the housing program. We are the lead for Housing First in Simcoe County. So we work with individuals to connect with landlords and resources that will help them get housed. Also, we have family homes. Family homes are families such as you and I who are willing to take someone into their home and have them be part of their family. So we have that as well. And we have a number of other programs, including our community participation, which is individuals who go out into the community and partake in things such as physical activities, so going to the Y or the rec centers, or even going to movies. So we are a multi-service agency that support all people. We are dealing with it in the way that my staff have always dealt with anything. They're very creative. They're also very attuned to the needs of the individuals we support. So, as you can imagine, individuals with an intellectual disability have a very hard time changing their routine. You know, they like doing things the way they normally do. They like going to a Tim Hortons for their coffee in the morning or their tea. They like to go to the library to take out a book or to just spend time. They like to go into the community just like we do to go see a movie. So our staff are required to help them understand why they can't go out and do the things they normally do. They spend time explaining the reasons for them not being able to go home and see their families. So it is something that we are very mindful of and spend amount of time with our people supported to help them understand the reasons for the change and help to connect them through technology. Technology has been the most important thing in terms of connecting individuals right now. We have individuals who are connected with their family members or within the group living locations to be able to see each other. They may not have physical contact, but they have social contact by being able to have a coffee online together or a tea or be able to cook a meal together online. So technology has really helped us through Skype, just as this, or FaceTime or any other platform that has helped us to connect the people we support to their families to be able to help it be as normal as possible for them. In terms of what the support workers are doing, they are working with the individuals within their homes and within their neighborhoods. So, you know, definitely you can go for a walk or you can go out in your backyard and go on your deck and do things like that. But there's no interaction in the community. People supported are not out in the community because, you know, when our medical professionals tell us to practice social or now really physical distancing, we take that at heart. These individuals are very vulnerable. They have a number of underlying conditions, and we know that they would be the ones that the virus is very much attracted to. So we make sure that these individuals are able to do things at home. So our staff, who have been very creative in doing things with these individuals, do things at home. Work on different projects at home that individuals might want to work on, or play games, or create activities that are helping to keep them occupied, but also keeping them thriving. It's a natural feeling for us to feel anxious when things are a little bit topsy-turvy and our normal routine are thrown off. However, I must say that kudos go out to my team. They are as professional as you would expect. They are very much attuned to the needs of the individuals. And myself and my senior leadership team and our executive team are really focused on safety and the health and well-being of not only the people supported but our employees. So part of how I feel is to make sure that the health and safety of our employees are top of mind, that health and safety of the people we support are top of mind, and provide them with all the resources needed to be safe within the workplace. So that really helps to reduce the anxiety for myself. We do have a number of fundraising events. We have our golf tournament is the very first one out the door. Usually that would be happening as soon as early spring, right? So June. And what's happened is we have canceled our golf tournament. We have communicated that out based on the circumstances we're in, the advice that we're hearing from the community in terms of the health community who are helping to direct our actions. We do follow them and base our actions on recommendations from our medical officers of health here locally and more provincially. So the golf tournament is canceled. But I think that even though it's canceled, we will come back to our golf tournament again next year. There's no doubt in my mind it's one of the most beloved of our programs, and we are going to miss that. We work with a number of community partners on that, and it's so important that we recognize that even when we come out of this and get back to the new normal, organizations and individuals are going to be trying to pull themselves together. We can't expect them to just jump into an event. And we know also that when it comes to resources, those are going to be limited as well because organizations are going to be starting up again. So they need to build up their own capacity. And it doesn't make sense for us to have a golf tournament or whatever event it is that takes away from that. Getting back to a new normal at Empower Simcoe is something that is always on my mind. I do have a pandemic group. My executive team and I make up that group, and we always think about the what if. So 4 weeks from now, what is it going to look like, and start to maybe model some of the activities that we can see putting back into place. One of the things that's really opened my eyes is the ability to do things differently and to work more creatively in delivering our services. So we are looking at how we would roll back out. And I don't see us sort of opening the doors and sending out a big announcement saying we're open for business. It's not going to be like that. I think what's going to happen is we're going to open up slowly based on the programs that we see and based on our community partners, because one of the things that we do is to work hand in hand with our community partners. And we can't open up, for example, our early on without having our schools open. We can't open up our community participation without the libraries being open and the rec centers being open and movies being open. So I think it's going to be a real thoughtful process and working and listening to what's happening around us in the environment. But we are planning that out because we do want to make sure that we're ready to ease into it. The same way we implemented our pandemic plan was in a very graduated way. So we worked to the point where we couldn't work in the environment anymore, and then some people began to work from home. So in the same way, we're going to continue to do that. Right now, we're doing essential services only. So what we would do is to add back maybe another service and add back another service, but take it slow. It's such a turbulent and anxiety-provoking time. It is like nothing we've ever seen. It absolutely isn't, not within our generation. And we work in a sector, the developmental services sector, that is almost outside of the health system, right? So the Ministry of Health looks after all of us, right? We know that we have universal health care and we can get our support through the hospitals and through the health system. However, because we work through the Ministry of Children, Community and Social Services, the developmental services sector is pretty much under the radar. We're not seen very often. We are overlooked in some regards. So we hear about long-term care and, our hearts go out to all of the workers there and the leadership that is trying to manage. However, I think that developmental services and people with disabilities are also very vulnerable. We also have a system where our staff are not paid at the level that you would expect for a system that requires such care of people that we love. And we also know that whenever there's a conversation about anything in health, we will hear about frontline workers or individuals who are part of the front lines who are delivering such important services, but you never hear about developmental services. We get left out. You'll hear about the nurses, you'll hear about the personal support workers, you'll hear about the police and the fire, but you never hear about developmental services worker, and they do the most important job as much as someone else in healthcare, and we get forgotten. So I think that for me, the one thing I would want to say is we need to look more broadly at our sector and remember that people with disabilities are also part of our environment and part of the fabric of our society. And they continue to be marginalized even during the time of a pandemic. Thank you to my employees, and I don't even call them employees, to my team. We are a broad, big team, and whether you're the CEO like myself or you're frontline working in a group home, you're part of my team, and it has not been lost on me the amount of commitment and professionalism that has been shown by the team at Empower Simcoe. They continue to do an excellent job. They continue to come to work, support the people that we have here who are vulnerable, but also taking care of themselves because they're just as important. They are individuals who are on the front line, who are putting their lives, on the line for people who are vulnerable. And I want to make sure that they know that I appreciate them, and the board of directors here and the executive team thank them very much because we couldn't do it without them. And to say, hold your head high. You are doing a fantastic job. What fear is something that we all feel, and it's okay. It's okay. And we will together get through this because I know that we have the commitment and we have the capacity and we have the love to share to make it happen.